Hi, my name is Nancy Turin. I'll be doing the skills video administration of intramuscular injection. I'm wearing the correct uniform. I have my badge. I have all my supplies. My supplies consist of a pair of clean gloves, my vial, 3 alcohol pad swabs, gauze, and I do have this post-it. This post-it doesn't have anything on it. I'm not reading from it. I'm just showing you that there's nothing on it. I have it because I want to show you my supplies or my syringe later on. This helps to focus on the syringe. For this particular injection, we would need a 22 to 25 gauge, and it would need to be 1 to 1.5 inches for the needle. And for the syringe, it needs to be 3 milliliters. Also, if you see my video becoming blurry here and there, that's just because the camera is trying to focus on me, but I did not edit the video in any way, shape, or form. Excuse me. And then the first thing we're going to do is verify the provider's orders. The second thing we're going to do is verify the 6 rights of medication administration, which is the right patient, drug, dose, time, route, and documentation. We will then check the medication order in the EHR and then verify the medication against the MAR. This is for the first time. We will have to do it 3 times in total before we give medication to any patient. So the medication I have on hand is morphine sulfate, 4 milligrams per milliliter, but the doctor has prescribed the patient morphine 6 milligrams IM, meaning intramuscular, times 1 dose. So we will have to do some math, some dimensional analysis. So we would be looking for milliliters, and we would have 1 milliliter over 4 milligrams times 6 milligrams over 1, and then we would cancel out the milligrams, multiply across, so we would end up with 6 over 4, so 6 divided by 4 would equal to 1.5 milliliters. And that is the dose we will be giving to the patient, is 1.5 milliliters. Now that I've gone over that, we're going to take all our supplies, all my supplies, and go to the patient's door, knock on the patient's door, enter the room, close my patient's door, close my patient's curtain to ensure patient privacy. I'll put my supplies down on a flat, dry, clean surface. I'll perform hand hygiene and introduce myself to my patient. Hi, my name is Vivian. I'll be your nurse today. Can I have your full name and date of birth? As the patient speaks, I'm going to look at their wristband to ensure 2-patient verification. It is the correct patient. Okay, Mr. Smith, are you allergic to any medication, food, or environmental factors? No? Perfect. Give me 1 moment, okay? This is where I verify the medication against the MAR for a second time, and we can proceed because it is correct. Okay, Mr. Smith, I will have to go over the procedure for you today. The doctor has prescribed you a morphine injection, which means that for this morphine, what will happen is it will interrupt the pathway for a pain response to the brain, meaning it is a pain relief. And there is common side effects. So common side effects meaning we expect these side effects to happen when I administer this dose to you. The common side effects are drowsiness and constipation. If these happen and they worsen, please let me know. Now, some adverse side effects, adverse meaning we absolutely do not want these to happen. These adverse side effects are having difficulty breathing or hives. Now, if this happens, let me know as soon as possible and I will tell the doctor immediately, okay? Another note is that when I administer this injection, you may also feel a slight tingling or burning sensation in that area. That's just something to note. Any questions, comments, or concerns? No? Perfect. Give me 1 more moment, okay? This is where I verify the medication against the MAR for the 3rd time. So I'm going to perform hand hygiene, and I am going to don my gloves. Now that we have verified the medication for a 3rd time, we can now administer the medication safely. All right, so let me just move this real quick. Okay, the first thing we're going to use is alcohol prep pad. These are open due to practice reasons, but in actuality, we would not use already open supplies. Okay, we're going to dispose of that. I'm going to take my syringe. We're going to open that. Dispose of that in the trash. Open this. Just just dispose of that. Okay, before we actually open the cap, we're going to draw in 1.5 milliliters of air because that was our dose for the medication. So, all right, now that we've done that, we're going to put this medication. We're going to inject the air into the vial, invert the vial, and we're going to, I want to make sure I'm looking at the correct units. All right, we're going to make sure that it is at 1.5 milliliters, and I see some air bubbles. So either we will do, we will flick the syringe so that the air bubbles come out, or we will then we can inject the medication and redraw the medication. All right, this is actually appropriate. Make sure one more time. Yep. All right. So one more time, I'm going to flick the medication, making sure that there is no air bubbles. Yep, no air bubbles. Okay, and I'm going to move this to the side. No air bubbles, so I am now going to use the swoop method, put on the cap. All right, now I'm going to show it to you. Okay, it's right here. All right. Now we're going to leave this here. And there are 3 locations we can do the injection. It could be the deltoid, the vastus lateralis, but today we're doing the ventrogluteus for Mr. Smith. And the way we are supposed to find the injection site is we're going to use the heel of our palm at the greater trochanter. We also want to make sure our thumb is pointed towards the groin. We want to make sure our index finger is at the anterior superior iliac. Our middle finger is supposed to be on the iliac spine. So now we have made a triangle, and in this triangle we are supposed to inject at the middle of the spot. So just to mark that, I'm going to grab another alcohol prep pad. If only it will come out. Okay. I'm going to grab another alcohol prep pad, and I've marked the area. Okay, so before I use this, I am going to make sure that I'm going to take note of the integrity and the muscle mass. I am making sure that there is no discoloration, irritation, or bruising of the skin, which he's good with. I'm going to palpate the skin to make sure there's no tenderness and no hardness. He is good there. Now I'm going to use this alcohol pad, dispose of that in the trash, and I am going to wipe in the middle, outwards, 2 inches. Now this alcohol pad is just supposed to mark where the injection site is, and yeah, and so we want to make sure that dries. We don't want to fan it. We also don't want to blow it. We're going to pretend that it's had enough time to dry. Now I'm going to uncap this. We are supposed to hold it like a dart, and then we are supposed to hold it 90 degrees, or like a palm down. It's a 90-degree injection. So we will now use the ulnar side, so this part right here, the ulnar side. We're going to make sure that the skin, we're going to push it down a bit so the skin is tight. We're now going to press the site a little bit, just a little bit, and then we're going to quickly and smoothly go into the injection site. Down. All right. We're going to hold to steady the injection, the needle or the syringe, and we're going to inject the liquid. And the liquid must be injected 10 seconds per milliliter. So, very slowly, very gently. All right. Okay. Now we're going to wait for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So wait for 10 to wait for 10 seconds. And then I'm going to lift up. We're going to dispose of this in the sharps container. We're going to gently put the gauze on top. We don't put pressure. We don't want to rub it or anything like that. We're going to dispose of this. And we want to make sure we don't rub it, massage it. Now we're going to make sure the patient is not bleeding. He's not bleeding, so he does not need a Band-Aid. Okay, and I want to make sure that my patient is comfortable, and he is comfortable, so we are good. I'm going to clean up my area, and I'm going to take off my gloves, perform hand hygiene, and document my procedure.